Hi and welcome everyone. Thanks so much for joining us again today. We're gonna keep it spooky because it's still the Halloween season when you'll be listening to this, and we thought that we would take a little bit of a different turn. Instead of talking about horror stories, we're gonna talk a little bit about death and dying, and some of the ideas and tropes around like nurses in horror films and whatnot. So yeah, that's what we'll be talking about today.
Yeah, I think this is a very timely topic because, of course, being in nursing, we deal with death and dying all the time, depending on where you work, of course. I think that it just shows the diversity of nursing where you could potentially be working in an area where you deal with death and dying daily, like if you work in palliative care, or maybe if you work in another area like maternal child, it might be something you see very rarely. And when you do see it, it's unexpected and it can be very emotional. And we just wanted to talk about how nurses are portrayed in the media, on TV shows and movies, and how they do get it wrong a lot of times.
Yeah.
Well,
A
I would
lot of
say
the
most of
time.
the
Yeah,
time.
yeah, yeah.
Yeah, so just talking about that in the spirit of Halloween and that kind of thing. Um, so Amy, why don't you start with our first topic?
Yeah, so I think the first thing that we should hit off is, why do people find death so scary? And just like if I think about my own feelings surrounding death, I think it's because it's so final, right? And if I can recall my first time where I actually saw a patient die, it was quite traumatic for me, to be honest. Like I don't know how well they prepare you again in nursing school. I know that sounds really bad, but like I don't think that I fully was equipped to understand, being that person in the moment while this patient was dying. So for example, this was actually when I was doing a long-term care rotation, and the it was an elderly gentleman. And I remember what made this situation so sad and so difficult was the fact that he had no family. So I was actually taking care of him for a long period of time. And because he was palliative, he didn't really talk very much. And I remember kind of going through the charts, like no contact with his children. Like I didn't know what the reason was. I wasn't trying to find out, because at the end of the day, I just want to, do my job and make sure I was looking after this patient. And I remember um, when I walked into the room, he was having agonal breathing, and I was kind of like, "Oh my god, we need to call a code." And then it's just like, okay, it's dawning on me the fact that this gentleman's dying, and he doesn't have any loved ones to call. There is no one, and that role was going to be me. So I remember actually talking to my preceptor, and she's like, "Yeah, just go in there, be with him." And I was scared, like I was terrified. And I remember just sitting in the room while he's having these agonal breaths, and I kind of walked over towards the bed, and he kind of like gasped and like looked at me and was like super terrified. And then I think he kind of took his last breaths, and I was just like, if that's the way dying is, like that is horrifying. And I just felt,
Hmm.
one, I felt horrible for the patient because he didn't have anybody. At least I was there. But in his last few moments, he looked very scared, and it was scary from his end, I'm sure, and definitely scary for my end, because after that they're just like, all right, that's it. And they like threw a weight sheet over him and whisked him off to the morgue. And I was just like, oh my god, like 2 seconds ago he was there and now he's gone. And I don't
Hmm.
know, for me it was terrifying. I mean, since then, um, I actually haven't really seen very many people die, particularly older people, because, and I think that's just the nature of our job. We're maternal child nurses, so typically,
Hmm.
if we do see a patient dying, it's typically, and this really sucks, it typically is an infant that might need resuscitation. And then there are the really really horrible cases where there is a fetal demise, where there's a stillborn, and that again is a really 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 difficult situation. And I guess we haven't talked about it this month, but we are aware that the month of October is perinatal awareness loss month. And again, just a really difficult time for anybody. But death is scary, and I think death is scary because people don't know what's beyond, if there is anything beyond that, when you close your eyes and you take your last breath.
Yeah, Amy, you said so many things that resonate with me. And just starting with what I recall from nursing school, we had to watch this really, really sad video about a cancer patient who was palliative. And it was really emotional because they went into a lot of interviews with her up until like her final days. And, she's crying in this video. And then we're crying, like
One
watching it.
second,
Like
Sarah,
it
you're
was,
cutting out a lot. I don't know if it's my internet or yours.
let me check. It should be okay. Do you want me to start over? Am I still cutting out?
You were cutting out, but start over now.
Okay. Just thinking back to what I recall from nursing school, we had to watch a really emotional video about a terminal cancer patient who was dying of breast cancer, I believe. And, it went into a lot of emotional interviews where she's crying really hard on the camera. And I'm looking around to my colleagues, my classmates, sorry, they're crying just as hard. So I think that it was probably not the best video for us to be watching as student nurses who hadn't dealt with death and dying and really didn't know what we were getting into. But I appreciate that they wanted to at least bring some of that element into our teaching. Um, but just thinking back to death that I've dealt with, it has all been, infants, unfortunately. So when I worked in NICU, when there was a neonatal death, we had to do a lot of things to prepare the body. So we had to take these molds of the baby's hands and feet. We had to, bathe the baby, dress the baby. Sometimes we would take pictures, work with the family, which is obviously really hard because it's so unexpected.
Right,
And I
yeah.
think the part about death that I feel like needs to be addressed is just managing expectations on not just for the family but for the nurse involved, right? Like, was this death expected or was it unexpected? How old was the patient? Because I think that really affects how you feel as well about the situation, whether it's a 3-year old, a 30-year old, a 90-year old. It changes how you feel about it altogether. And I think it's just about what you do to deal with it. Like, how do you prepare yourself? What are your personal beliefs around death and dying, and what have you experienced in your personal life? I think that all plays into how you feel and how you react to situations.
Yeah, no, I agree. And I think just kind of going back to what you said, like for the most part, we have our experiences have really been infants and neonates. But I kind of want to bring in a little bit about my mom's stories and just with, I don't know, like it's kind of a weird thing that my mom has where she is, I don't want to say she is like the angel of death. That sounds really effed up. But just she's had some really, really tough experiences with death with both of my grandparents. So I don't know how it ended up happening, but she ended up really literally being the person with both my grandfather and my grandmother at their most, difficult time. So again, when my grandfather was dying in Brampton at the Peel Hospital, Peel Memorial, so not the current hospital now, um, she was the one that was holding his hand while he took his last breath. We were all around, but he specifically requested my mom.
Oh,
And
wow.
then again with my grandmother, which was even more messed up. Actually, I just had my twins, and my grandmother had asked my mom to come out to Florida because she just said she wasn't feeling well. So my mom had flown out to Florida to be with her, and she had asked me, she's like, "Are you sure you want me to go?" And I'm like, "You know what? If grandma's calling you to go, like just go. Like I'm here, Jordan's here. I'll have whatever support I have to have." And I remember kind of contemplating, even, I think my twins were around 3 or 4 months at the time. I was contemplating even leaving them to go out to see her. And my grandma, I think the day she was going to be discharged, um, they checked her out. They said she had a clean bill of health. There was nothing else they could do with her for her. They had noticed that she had some clots in her legs, but they said that they had put a stent in and everything should be fine. And as my mom was walking her down the hallway of the hospital for discharge, my grandma had a massive PE. And
No way.
yeah, and the way my mom described it, like, I mean, my mom said essentially my grandma grabbed onto her, and she said that I guess the pain or the force of whatever happened to her ended up knocking her dentures out. And my mom said she looked absolutely terrified. And she said she could literally feel my grandma's body and her life being whisked away at that moment. And for
Oh
my
my
mom,
god.
that was traumatic and terrifying and a really horrible experience. But again, like I was saying at the beginning with this other gentleman, just that these last moments for some individuals, and even just the way my mom and like had to deal with that was really really terrifying. And I think, I mean, I know my mom's a strong person. She'd identify herself as a strong person, but whenever I hear her talk about my grandmother's death or my grandpa's death, particularly my grandmother's death, she talks about it in a way that it's fearful because, she was the one there with those last moments. And again, I just think that it's so final. We don't know. We don't know if they're in pain. I think we make these assumptions, and for the most part, we have
Mhm.
medications that we
Mhm.
say that makes them feel comfortable at that time. But I think for my grandma, in terms of my mom's experience, she said it didn't look like it was painless, even though I think it happened rather quickly. I think the shock
Mhm.
of it
Mhm.
was really scary for her. And I mean, I think that, like, for example, I do have an aunt that's considered palliative as well. And my mom's there, always taking care of her, always looking out for her. And I get scared for my mom because I'm just like, I don't, how much more of this can you take? But again, like, think about nurses who work in palliative care, nurses that work in these areas or COVID units that see death and dying all the time. I mean, how do they manage it? Maybe
Mhm.
that's maybe what do you think? How do nurses tend to deal with death and dying?
Mhm. I think that's a really good question. And just to start off with your mom, like that must have been so traumatic for her. And, for your grandma to be so close to leaving the hospital and then have this incident happen. I hope your mom doesn't blame herself because she just happened to be there. But I could see how someone might feel that
Right.
way. Um, but just about how nurses deal with death and dying, one thing I forgot to mention is that I used to work in an early pregnancy clinic. So we basically dealt with first trimester losses like Monday to Friday, every day. And I think that there's different ways that nurses deal with death and dying when it's always there. I think number one is you become desensitized to the situation, which isn't great, but
Right.
I think it's more of a protective mechanism because if you really, were really emotional about every single patient, it might be too much for
Right.
you. And then the second thing is I think that nurses will kind of reach out to each other. So if there's a colleague that you work with and you deal with death and dying often, maybe you just kind of debrief with each other and talk about how you're feeling. Or maybe you have some close family or friends that kind of get where you're coming from and you can talk to them. I think that as nurses, though, we generally feel like people outside of the profession don't really understand what we're going through. So that can be a little bit more challenging. I also think that debriefing is important if it's something that doesn't occur regularly. I think debriefing, whether it's that same shift or whether you let some time pass and you do a formal debrief, is really important. And last but not least, what we always talk about is take advantage of the supports available to
Yeah.
you. If you have mental health benefits, if you have an employee assistance program at your work, make sure you know what's available and it's there for a reason, and make sure that you use it when you feel like you're getting overwhelmed, or even before that point. If you just want to prevent yourself from feeling that way, it's always a really good option.
Yeah, absolutely. And I think, I think the whole discussion on the desensitization, I think there's one point that you did miss too, and nurses can have really dark humor. Like, I mean, sometimes that's
Oh
the
yeah.
other maladaptive, but nonetheless coping mechanism that, sometimes it becomes dinner talk, and something a nurse might find funny is not funny to other people sitting around the dinner table eating, their meal, when a nurse might be, making a joke or saying something. It's like, okay, it might be inappropriate, but maybe we should ask more questions in terms of like how that person's actually dealing with that. And I remember, and also just talking about the other angle of, that desensitization is, I think it's actually okay to show compassion. It's okay to show that you're hurting too, and that, you're there for the family and the patients. I mean, I don't think you should let out a river of tears in front of them. But, like, I've had my moments where, I can remember a really, I guess I would say it was a very impactful time for in terms of my nursing experience, where there was a patient, and I don't know why it impacted me this way. It was a fetal demise. And I think maybe it was because I was that triage nurse and I was the one doing the assessments, knowing that, the bad news was coming. And I think I've said this before, like I've never heard a patient let out a scream like that. And I think I just had to be a human being, like, shut off the
Hmm.
being a nurse, being a healthcare professional, just be there in the moment. And when the patient left and was wheeled down to postpartum, which is a whole other situation to put a pregnant patient who just had a loss on a postpartum unit where you hear babies crying. Um, I remember when she got wheeled down there, there was a little bit of a transfer of care. I bawled. I walked into that medicine cabinet. Opened that door and I let it rip because it was awful. It was a horrible, horrible thing to see. And it was just, again, it wasn't my experience. I didn't want to be that person that was bawling there in front of her face. But, I think that just being in the
Hmm.
moment with the patient, like I did have tears running down my face. I wasn't like wet like a river, but I took the
Hmm.
time to, go and let off some steam because it's terrible. It's scary. And I think that, again, I think talking about death and dying is a really important thing. We don't do it very often. I recently had a very, difficult conversation with a family member recently, and being in a situation where I might be, a power of attorney or someone's, oh my gosh, I'm drawing a blank. You know what I'm talking about. um,
Substitute
Substitute
decision
decision
maker.
maker, or even, executor of someone's finances at the
Oh,
end of
the
the day.
will.
And I think that
Hmm.
we don't think about it. I think we reserve the thought of death for people who are elderly, but we shouldn't, right? Like, I
Right.
mean, I'll ask you, and you don't have to answer, but do you have a will?
I do
Darn, you're
have a
so
will
much better
actually,
than
and
me.
do you? You don't have a
Yeah, I
will?
don't, and it's funny. It's not that I don't have the opportunity to, because obviously when we purchased our home, the lawyer's like, "Hey, you should do this," and I'm like, "Yeah, I should." And every time I've started filling it out, I'm like, I can't do this right now. And I don't, and I know it's the right thing to do. And it's just like, for example, when I told you we had some family members over and we were talking about, advanced directives, and we'll maybe talk a little bit about that. So if you're not a healthcare provider, you can have a better understanding what that might be. But I kind of was just like, yeah, like I need to get on the ball with this. But I also expressed what my wishes were to my family members at that time if, something was to happen to me. But I don't have a will. Isn't that messed up?
Okay. You know why I do have a will? I had an aha moment. So a friend of a friend, when I had just given birth to my son, she posted on Facebook that her friend passed away from the flu. She was perfectly healthy. She was like in her 30s. And I was like, holy shit. I'm like, oh my God. So literally the next day, I made appointments for us to get our wills done. I had it done in
Hey,
Walmart,
well.
so super classy. I was like, whatever, it's a
Yeah.
good price. Like, let's just get this done. So we got our wills done, and we didn't prepare anything. So they're like, who do you want to take care of your son if something happens to both of you? So we had to think about that in the moment, but I'm glad we did it and got it over with, because if we didn't have a will and something, God forbid, happen to both of us, like what's going to happen, right? And I haven't updated it since I've had my second child, which I keep saying I need to do,
Hey
but at
man,
least I have this
your
first
light
will.
years ahead of me already. Like, I mean, I think I've expressed things to Jordan. He's expressed things to me, but we don't have anything concretely written. And I think that is for us the next step. I mean, I hate
Mhm.
sitting and thinking about, like, okay, if I wasn't here and Jordan wasn't here, who would look after our kids? And I think it's again, it's just that whole thought of everything being so final, not knowing what really happens. Is there life after death? Is there not? And I think that obviously believe depending on your
Mhm.
beliefs, but it's just I feel it's so final, and I know I need to like whip my ass into shape and get it done, get it over and done with.
Oh, now that I know this about you,
Oh
Amy, I'm not gonna
no.
let this
So
go.
I
But
do have some work to do on my end, but maybe I'll just circle back to, what an advanced directive is. And I think that this is actually an important conversation for everyone who's listening. Um, to let people know what your wishes are, especially when it comes to death and dying, because I think at the end of the day, you should be the one who makes those decisions. You should be the one who has say in terms of, what types of supports do you want? Do you want life altering supports? Do you want to be on a ventilator? Like, you can make it as specific as you want. Like, I think, people tend to have these blanket DNRs. Let's say you got into a car accident and you're like in your 30s, maybe you don't want a DNR, right? But you could say, hey,
Right, right.
what would my quality of life be? And actually really explicitly lay out, whether it's speaking with your family doctor or whomever, like what your wishes are. Because I think those are hugely important. And I think it'd be so hard to be, that family member, if you haven't expressed that, to be like, okay, now this patient or this my loved one is critically ill, and I have no idea what they would have wanted. I'm just guessing. I'm
Right,
assuming,
right.
right?
So I think you do it mainly so it's for yourself, but it's for everyone around you too,
Absolutely.
right? So I always think of the situation, let's say I got into a car accident and I'm now quadriplegic and I can't do anything. What would I want for myself and for the people around me? And the reason you have advanced medical directives and a will for that matter is that you're going to make everything easier for your family, because I've seen really ugly
Yep, it
situations
gets
where
ugly.
someone's passed away without a will, Amy, and the people that are left behind, they're fighting over the pettiest little things. Even when you do have a will, I've heard from a good friend of mine, it's still
Yeah.
a lot of work. So even if you have everything lined up, it's a lot of work for the executor. So really, you just want to make things as easy as possible for the people that you're leaving behind. And so I think that's hugely important. And it's hard to think about death and dying, but when I went to this lawyer, there was like a template.
Yeah.
So it's not
Yeah.
like I had to write anything out. You just had to like check a few boxes, tell them what name to fill in, and then it was
Yeah,
done.
no.
So
I
it's
know you're
pretty
I know you're
painless.
right. And the other piece that you're like 100% right. Like, when it comes to like leaving nothing behind, I don't want to be the one that tells the story, but like maybe I'll have my mom on the podcast at some point. But my parents were, actually, I should say it was my mom who was telling me a story just like 2 weeks ago about a death that happened a while back in our family. Probably I was maybe 10 to 13 years old, and she was telling me about this crazy fight, like fist fight, that broke out at a funeral. That my mom, yes, this is what
No.
I'm gonna.
Your mom
Yes,
was
I
at
and I have,
this? Your
this is
mom.
why I think I should have her on. And she told me literally she had hit people after her. I'm like, I could have been orphaned because, and you would have never told me. And she's like, oh, she had a bodyguard with her in Jamaica who was like a paid bodyguard to protect her because she and my dad had people leveling death threats at her. And I was just like, oh my god, like over what? And I think it was like over a piece of land or something like that in Jamaica. But like, I've been at funerals where people started arguing, and it's just, or I've heard of stories where people are saying like the will's being read and people are like freaking out. Don't make it so complicated. Like, just, and you're right, I have work to do too. But for our listeners, do you guys have a will? Do you have advanced directives? And again, I think the person who is your power of attorney or your executor, they don't actually have to be the same person. Like, you could have one person who deals with just your finances and someone else who deals with your medical care, or they could be the same person. I think it just depends on who you might be most comfortable with at the time.
Right. And it sounds kind of morbid too, but when you think about who is going to be the executor of your will, ideally it shouldn't be a
Right.
parent, because let's face it, like, are they going to be here in 30 or 40 years? So you need to think about someone that's your age or
Yeah.
younger. And these are hard conversations to have, but again, it's like just getting something out there is better than having nothing at all. I would hate to see anybody, pass away and then whatever little is left has been fought over, and then all that money goes to lawyers because they can't
Yeah,
figure out
that's
who it
that's
goes
super
to.
messed up. I think from our medical standpoint, because I think when it comes to us, we're kind of more looking towards who's the substitution decision maker, who's the person making the decision, who is the power of attorney. And again, I think as healthcare providers, our job is to make sure that, one, we are fulfilling what we believe would be this person's wishes, if there are no wishes expressed, and then two, to bring people together to have a collaborative discussion. I think those situations where you have a palliative patient, we know that the trajectory is going to be death. You need to sit people in a room and be like, hey, we need to do this. I think at least you can mitigate some of the fallout if you sit down and have a conversation with people knowing that what's going to happen. Sorry, I had a little fly. I was like, but yeah, that's kind of like my thoughts in terms of some of the work that needs to be done in terms of understanding death and dying, and just how nurses overall cope with death. And I think, I think I'd say that overall nurses do a pretty good job. I think it's stressful. I don't think that, there's any person that would sit there and be like, yeah, this is easy. This is great. Um, Definitely not the case. And, it's just not an easy situation. And we just have to do our best and reach out for help, like you said, if we need
Hmm.
them.
Absolutely. And I think there's some strategies that we can use to deal with death and dying when you are feeling like, this is not going well, or let's say this is the first death you've had. I think the first thing is to recognize that death is
Right.
inevitable. So whether or not you expected it, whether or not it was expected in general, you know, it's just a part of life. And I think the other thing is, even though it's not your family member, it's your patient, just give yourself that time to grieve, because you're human after all. And, depending on how the patient passed away, it might touch a nerve with you. So if this was a patient that had a miscarriage and you've had one as well, that might really trigger something
Yeah.
in you, and that's okay. Um, Communicate with your family members about how you're feeling, even if they may not really get it. At least they understand that you had a hard day, your patient passed away, and you just need that time to yourself or whatever. Like I said before, talk with your colleagues. It's always helpful if there's someone more experienced that has gone through this before, or someone that you really look up to. Just, say, hey, how are you doing? How have you dealt with this in the past? Because I'm really feeling overwhelmed about, this patient that passed away. um, if you can even just take some time to yourself, get outdoors, go for a walk, take a bath, just something to just get your mind off it. And you don't have to always look for a reason. So I know as nurses, as mothers, as women, we tend to look at ourselves and think, if I just done this or I'd done that, maybe things would be different. So I think it's important to know that you probably did your best, and you just happen to be there because of the nature of our job. So somebody was going to be that patient's nurse, and that somebody
Right.
happened to be you. And also, try not to dwell on grief, because I think that if you let it eat away at you, it's really just going to make things worse. So do some of the things we talked about in terms of finding someone supportive to reach out to. I think that's really important. And the last thing that I just wanted to mention is just your comfort level about death and dying. I did find a study that said younger nurses under the age of 30 consistently reported stronger fear of death and more negative attitudes towards end of life patient care. And that just might be where you are in terms of life experience. You just haven't had a lot of that
Right.
exposure yet. And it's okay. Like, I think we all kind of grow and learn as we get more
Yeah.
experience in
And the
nursing.
one last piece that I want to add specifically to for healthcare providers, so nurses, physicians, allied health, whoever might be encountering a patient and family, take that time to be compassionate, okay? I was actually at just recently at a McMaster retreat where they were talking about compassion, and they were talking about how healthcare providers are really sucking at compassion right now. And they were saying it takes 40 seconds or less to be compassionate, to just say, and to show empathy, to just, I think there was like an illustration where, the person was down in the pit feeling really low, and you could have been that person shouting down, like looking down, like, hey, that sucks. No, that's sympathy. They know that their situation sucks, but it might be just, coming down, being on the same level with them and be like, hey, I'm here with you. I know this is hard, right? And I
Yeah.
think that there's a lot of burnout. There's a lot of compassion fatigue with COVID-19 and various different things that have been happening over the last 18 months. But please, please, please take that 40 seconds or less to put yourself in that other person's shoes, and to know that they're going through something that's very, very difficult. Just
Hmm.
please don't be an asshole. Show some
And I think
compassion. I mean, I think at the end of the day, we all got into this profession for a reason, and I think that reason is to, one, yes, we want to see better health care outcomes, but it's because we genuinely care. We want to see that, we're providing the best care and the best resources we can to patients and families, and showing compassion and empathy is hugely, hugely important. And I think some way along the way in our journeys, we've lost the ability to be more compassionate. And I think it's time to turn that back around and make sure that we're showing that compassion to our patients and
Mhm.
families.
Yeah, and if you don't know what to say, just keep it really simple. Just say, I'm so sorry this happened to you. Sometimes I think nurses, or not just nurses, but people in healthcare, they try to
Yes.
smooth things over. At least they weren't in pain. At least they were only X number of years old. And the worst thing that you can say to a mother who's just lost a baby is, at least
Yeah,
you
at
can
least
try to have
statements
another
are
one.
the
So
worst.
that
Don't never.
and you can and you can literally say, I'm sorry, like, I don't know what to say. That is okay too. Be in the moment with your patient and try not to judge them or
Yeah,
trivialize what's happened to them. So I think just even saying that you don't know what to say is
absolutely.
better than
Yeah,
saying some of those other
even just
things.
a is
Yeah.
there something I could do for you in this moment? It could be just, like, hey, I just need 5 minutes. I need a glass of water. Like, just asking that, they're not going to ask you for money out of your wallet. Like, I think at that moment that even just hearing that, they'll know that you actually care about them, and you cared about their family member and their loved one. So let's try to pepper some compassion and empathy back into our care. So, and I think also what they said was, there was a study that was done. They were saying that the more compassionate the care providers are, there's actually like a feedback loop, or like not a loop, but a feedback of, I guess, dopamine that happens within the care provider that reduces their ability to that reduces burnout, reduces compassion fatigue, because showing compassion also gives you something back as a healthcare provider. So other things to think about, as opposed to just walking out of the room and not being compassionate and being awful. Don't do that.
Absolutely.
Yeah,
Wise
sorry,
words,
I was
Amy.
stumbling there at the end. Anyhow, so before we hand off onto, we've talked more about the more serious aspects. Let's talk a little bit about the like woo scary parts in terms of nurses' roles in when it comes to death and dying in media. Oh my God, we are always the bad guys. We are always the
Oh my god.
deadites.
Oh my god.
It's true, right? Like when I
Oh, it's so true. Like, honestly, I watched Nurse Ratched on
oh
Netflix
my
recently, and I
God.
was traumatized by it. Like, it
I
was
watched
bad.
bits and
Did you
parts
watch
and it
it?
fell off for me because I was just kind of like, you know what? I think this is kind of giving nurses a bad rap. Like, I think.
Kinda. It's so messed up. It's so messed up. I watched the whole thing, and I had nightmares about some of the
Fair.
episodes. I'm not gonna get into the gory details, but I had nightmares because it's so
But
messed
yeah,
up.
like honestly, when I was googling today, I was like, okay, let me just see, nurses in horror movies, physicians in horror movies. I'm sorry, my physician colleagues, you're gonna get it today. No, you're not. But essentially, like physicians tend to be, they might be the one like a part of the role where an evil spirit or something has been conjured up, but they never really themselves turn into this evil entity. They're never the ones that are walking around wielding a knife and being like this evil doctor, demon doctor type thing. Nurses, there are tons and tons of movies where we are like the number one bad guy. So I could just start naming them off. So I think the one that comes to my mind when I think about nursing and like scary nurses, well, one, yes, it's One Flew Over the Cuckoo's Nest. So that nurse, I think everyone talks about Nurse Ratched, like the OG Nurse Ratched, where she's like evil AF. And of course, she
Mhm.
had to be a psych
Yeah.
nurse. So I'm sorry, psych nurses, you guys get a bad rep too, because it's either like a crazy evil psych nurse or like it happens in a psych hospital or something. And then the other one that comes to my mind, have you seen the movie Misery? Oh my gosh, what's wrong with
No.
you? Sarah! Now you're gonna have
Okay,
to
I
watch
gotta
this with
add that
me.
to my
So
list.
the other nurse that comes to my mind is Misery. So I think that movie, so essentially there's like an author, it's a Stephen King movie. There's like this great author, he goes out to the woods to write a book. He gets injured, and this nurse decides to, she's also like a fan of his work, and she decides to take care of him, but she's like cray cray. But yeah, like just every
Mm,
time nurses were like zombies. I think if I think about Silent Hill, we were like zombified nurses, just
okay.
always evil. And why does it have to be us?
You know what?
Why?
This is like going back to what I say about how we need to be more present in the media, because when we're not, people just write crazy stuff about us, and we never get to be the hero.
Right.
We're always like the bad guy or the one who turns or the supporting character. this has to change. Okay, we need a nurse horror movie that
Right. Why can't
portrays
we be the
us as a hero. Like, we're
badasses?
the ones that are slaying. Why
Right?
can't we slay the
Pick
zombies or the
me, pick
monsters or
me.
the ghosts, right?
No, I completely agree, Sarah. Like, we are always literally demonized. Like, we're like being exercised. We're the ones that are like, the evil nurse with the like big needle, and we're like, we're gonna kill you. Like, why us? And I think I was thinking, I don't know if this is true. It's like, yes, they consider nurses to be the most trusted profession. And then I guess maybe making us the evil ones, it's like even worse because we're like with you 24 hours a day, or like, I don't know. But it's just, we need a different narrative. Like, hello, directors, whoever's out there listening to us, let's make a nursing horror movie where the nurse is the star and she or he is a badass. They're like taking names, slicing down zombies, killing the bad perps. Come on, we got to change this up. Can't be the
Hmm.
same thing over and over.
Right, right. I mean, even with the show Nurse Jackie, right? I mean, there was some issues with that
Yeah.
image as well. So I
Oh,
think there's still
definitely.
room for
Like, I
improvement
think
for sure.
for too long, there's just been this, like,
And
I don't know, man. I remember just watching some of these things and be like, this is not like how nursing is.
and can we please have a character
Yeah.
that's not white? I
Have a
think we need some
badass
diversity.
Chinese nurse who has a katana. No, I'm joking. But just like, yeah, like spice it up. Like, put some diversity in there. I think it's actually about time to see, like, for example, I'm now diverging here. But for example, watching oh my gosh, I'm drawing a blank. Watching why can't I remember? No, I'm drawing a
Grey's
blank. I'm
Anatomy.
such a bad
Oh,
human
what?
being. I just like we just watched the movie.
Okay, describe this show.
No,
This is going
this
to
is
be like
horrible. I
charades.
can't even go back now. It's over. But in other words, I think we just need to have more diversity in terms in media in general. And I think that it would be great to see a nursing superhero, a black nursing superhero, a Chinese nursing superhero. Change it up. Like, we could write something. Come on, ask the gritty nurses. We've got lots of ideas. But I mean, I think, we should be the ones writing our narratives. We're not these crazy zombie evil demonic people. Like, stop bastardizing our roles and making us, these horrible people. And we need to change that up. What do you think?
I keep thinking of House. You know the premise behind House, right? Like, there's this weird case and he always suggests something and everyone doesn't believe him and then it ends up being true. Like, I wish there was a show where there's a nurse who kind of dissects these interesting cases and, provides her expertise. And then she solves these like amazing medical mysteries and everyone's in awe. Like, why can't we have something
Because
like
we
that?
still don't write our own narrative,
Without
but
the
we're going to
without
change
the
that. We're going to change it. We're
backstory.
going to change it, Sarah.
Hmm.
But I mean, I think that again, put nurses in roles where they're actually the ones telling the story. Maybe there should be more nurse directors or nurses in the film industry. Like, who knows? Like, I don't know. I don't really know of any nurses who have really crossed over that line. But I think, especially when it comes to horror films, come on, like, throw us a bone.
I mean, consult us at least. Consult us. I would love to be consulted for like medical accuracy or even like, hey, how do you think that how
Right?
should we
No,
portray this nurse? And then we would
I
give them a whole
agree.
bunch
I
of
agree.
ideas.
But I mean, I think, long story short, what we're trying to say is, hey, horror film industry, nurses are awesome. Try not to kill us off every time you get a chance. And, make us the hero for once. Why not? Instead of making us a deadite. Because, we're kind of awesome.
Hmm.
But that's all I have to say about that.
So I think if we are going to wrap up this episode, we just wanted to dedicate this episode to Dr. Nadia Chaudhri. A lot of you may have heard of her. She was a very well known doctor who recently passed away from ovarian cancer. She shared her story on Twitter. I was really moved by it. I'm going to be honest. I was reading her whole story on a Saturday
Yeah.
morning
Don't
and
don't
I'm
do this.
crying. And I've never met her, I've never interacted with her. She just was so inspiring because she really advocated for better awareness of women's cancers, particularly ovarian cancer. And she really chronicled her history about how long she was experiencing symptoms, was misdiagnosed, and it turned into a months-long ordeal. So by the time she was diagnosed,
Yeah.
she was basically stage 4. And during the time she was in the hospital, she was doing a fundraiser where she would walk up
She
and
called
down
it
the
the
hall
Nadia
every day
Shuffle.
she was able to. Yeah, it was really inspiring, and she shared stories about how she told her son, who's my son's age, that she was dying, and that was really
Mhm.
hard for me to read because I feel like that could have been me. So we wanted to dedicate this episode to her in her memory, and just make sure that we talk more about these symptoms when we experience them, and
Yeah,
really
and I think
advocate for
she kind of
ourselves.
really, for me too, kind of epitomized that fear that people have surrounding death. She made death not scary. She really, I don't know if it would be saying like died gracefully, died with grit. I don't know. Like I don't know what the right words would be, but she really took this path and took us all on this journey with her, and it was beautiful. And I think if I could have a measure, a moniker of that courage and strength that she showed right up until the end, I think it would make me just marginally a better person. Like I think she was very, very, very amazing. She was a very amazing woman, and I think that was a huge lesson to all of us, to show, that even in the face of death, you can show compassion. You can. I think she fundraised as well, so she fundraised for neuroscience. Even in death, she was still changing the
Hmm.
world, and I think that is beyond amazing. And I'm thankful for her story and her family, and I wish them the best. I think they've, you know I think she continued to say that, her children were her moon and her stars, or her spouse and her son. And I think that,
Sun and her
I think when
moon, I think.
she said that she wanted to just be dining in the forest, with all of her family and friends amongst her, and I'm sure she's doing that now. So thank you, Nadia, for sharing your
I
story and your
have,
beautiful light with
yeah,
us.
I have so much respect for her. I think she really took the high road. She could have been really bitter about her misdiagnosis and kind of dwell on that fact, but instead she decided to use the little time she had left for good. And
Yeah,
that's
she's an
something that we
amazing
can
woman,
all
Dr.
learn from.
Chaudhry, for sure.